Young brains are developing at a really rapid rate, so it's important to recognize a concussion because it can affect things in their daily lives, anywhere from how they're doing in school to social interactions with friends, and even mood and behavior changes that can occur throughout the day. If we do recognize a concussion and help them manage it, we expect them to make that full recovery and be back to their normal selves.
Parents play a vital role in recognizing, managing, and supporting their child through a concussion. Here's what every parent needs to know. Because children's brains are still developing, younger individuals may take longer to recover from a concussion. Giving them the proper time and care is essential for a full recovery. Concussions can happen anywhere, not just in sports. Many concussions in young kids occur at school, on the playground, or while biking or skateboarding. Sometimes a child may have sustained a concussion outside of sports and still show up to play without realizing something is wrong. If you notice your child acting off or behaving differently, don't ignore it. Young children may not fully understand or be able to express the symptoms they're feeling. It's important to use age-appropriate language when asking how they feel. Recovery isn't just about rest, it's about the right kind of rest. Help your child manage their symptoms by pacing their activities and recognizing when they need a break. If symptoms get worse, it's a sign to slow down and rest. Sleep is one of the most important parts of healing, so aim for a full 8 to 10 hours of quality sleep each night. But be mindful, long naps during the day can make it harder to sleep well at night. Instead of short, frequent naps, encourage longer, uninterrupted rest to support the brain's recovery.
Recall from the previous video, we discussed what a concussion is, how it happens, and why recognizing and reporting it is so important. We also covered common symptoms, what to do when a concussion occurs, and the steps for recovery, including rest, gradual return to activity, and medical guidance. Now, let's take a closer look at how to manage concussions in your specific role.
When you suspect a concussion, there are important steps every parent must take. First, remove your child from play immediately to prevent further injury. Monitor their symptoms closely at home, especially during the first week. It's essential to have them evaluated by a healthcare professional who can guide their recovery. Inform their school and coaches so they can provide the right support. Encourage proper sleep and nutrition, as both play a key role in healing. And finally, check in with your child regularly, monitor how they're feeling throughout their recovery, and as they gradually return to play.
When my daughter had a concussion, we followed every step. Notifying her school helped ensure she got the academic support she needed.
Every state has a concussion law. Hawaii's concussion law states it is mandatory to remove an athlete from play as soon as a concussion is suspected. Concussed athletes are required to have a physician's clearance to begin participating in practice and play, and that annual concussion education awareness is mandatory for parents, coaches, sports officials, and school staff.
Parents are key players in their child's recovery. Advocate for their needs, monitor symptoms, and provide emotional support. As part of the concussion team, parents help by communicating with doctors, teachers, and coaches to ensure their child gets the right care. Keeping track of symptoms, encouraging proper rest, and making adjustments to daily activities all play a crucial role in a smooth recovery. It takes a team to manage a concussion, and parents are an essential part of that team. Alongside medical professionals, parents help create a supportive environment for healing. By staying informed and involved, they can ensure their child recovers safely and returns to the activities they love.
One of the hardest things was helping her understand that it was okay to rest. She just wanted to get back to playing. Eventually she got it, and we made sure to celebrate the little victories, like when she could go a whole day without a headache.
Every concussion is different. Follow the personalized care plan provided by your child's healthcare provider and never rush their return to activity.
There will be days that your players seem fine. Then there'll be days that they seem irritable, a little off, maybe exhausted. It's really important that you track those behaviors, different swings in moods. Talk to your team doctor, talk to your athletic trainer, but again, monitor and track the symptoms.
Healing from a concussion requires good sleep and proper fuel. I recommend getting at least 8 to 10 hours of good quality sleep in a dark, cool room where we can get uninterrupted rest. I also recommend eating leafy greens, lean proteins such as chicken and fish, lots of fruits and vegetables like broccoli and berries, avocado, olive oil, and nuts. And I recommend hydrating with water instead of sugary beverages.
Concussions can impact academic performance. If your child is struggling with concentration, memory, or appeared slowed down, it's important to advocate for academic adjustments at school.
I had to speak to my child's teachers and let them know that she might need extra time to finish assignments or to take break during tests. It made all the difference in helping her get back on track.
Communicating with teachers is key. Adjusting schoolwork and creating a supportive learning environment can help your child heal without added stress.
Once symptoms begin to improve, starting light aerobic exercise, like walking, can help the athlete feel more normal and support recovery. But it's important to only begin this step when a healthcare provider says it's safe. Always follow medical instructions carefully to avoid setbacks and ensure a safe return to activity. Aerobic exercises can help promote blood flow to the brain, support healing, and reduce symptoms when done correctly under the guidance of a healthcare professional.
There are many resources available to help with recovery. Don't hesitate to reach out to athletic trainers, school counselors, and medical professionals.
Our role as athletic trainers is we're here to help athletes recover safely and get back to the game they love. Recovering from a concussion takes a team. Multiple specialists work together to ensure a full recovery.
Because concussion is an injury to the brain, there are many systems that can be affected in your body. If you're not recovering within the first 7 to 10 days with all of the recommendations that were given for those first 72 hours, we may ask for our team of concussion specialists to help with different areas. For one, if your vestibular system or balance center is affected, or if you have a neck injury along with a concussion, we may have a physical therapist work with you to help that rehab portion. If you do have any visual deficits as far as tracking or even looking at things from a distance and they get blurry when they come near to you, we may ask an optometrist to help you retrain that visual center. If there are any issues in school as far as learning, memory, being able to read or take notes, we may have a speech therapist help with a cognitive therapy. And finally, we expect that this can cause a lot of anxiety and sometimes even depression in our teens, and we can enroll a behavioral therapist to help with those symptoms.
With the right support, athletes can heal properly and return to play with confidence. Safe return to play is a process guided by medical professionals. Returning to school and play should be gradual. Make sure to follow the child's doctor's recommendations and only allow them to return when they're fully ready. Skipping steps can lead to long-term complications. Here's the step-by-step process to ensure a safe and effective recovery. There are 6 steps to this process, and each step is separated by 24 hours. Step 1. Light activity. The first step is light activity, like walking to class or stepping outside for some fresh air. Essentially, anything you would typically do in your daily routine. These activities should not worsen any symptoms. Step 2. Light aerobic exercise. Progress to light aerobic exercises like stationary cycling. These exercises should be low intensity and shouldn't provoke any symptoms. Gradually increasing the intensity while monitoring how the athlete feels will help gauge readiness for the next step. Step 3. Specific sports drills. Once the athlete is symptom-free during light aerobic exercises, they can begin sport-specific drills. These may include running, technical movements, or other exercises relevant to their sport while still avoiding contact or high-intensity activity. Before advancing to Step 4, the athlete must receive written medical clearance. Step 4. Once cleared by a licensed medical professional, such as a physician, neuropsychologist, advanced nurse practitioner, or physician assistant trained in concussion management, non-contact training drills may begin. This next step involves non-contact training drills such as passing drills or multiplayer drills, where the athlete's skill set is tested without the risk of direct contact. This helps assess their physical and cognitive ability to perform under more game-like conditions. Step 5. Full contact practice. If no symptoms are present after non-contact drills, the athlete can return to full contact practice. This step should still involve controlled, monitored situations to ensure they're physically ready for the intensity and potential risks of full play. Finally, once the athlete has passed all previous steps and is symptom-free, they can return to full participation in their sport. This should only be done under the guidance and clearance of a medical professional. It's important to proceed with caution and never rush the process to avoid setbacks.
Returning to full activity requires going through certain steps in a certain order. We do this in order to make sure that we're going from a low-intensity activity to a high-intensity activity. Skipping steps in this process can be detrimental. You want to make sure that you check in with your healthcare provider or athletic trainer to ensure that you're doing the steps properly.
The step-by-step approach gave us confidence. We knew exactly when it was safe for our daughter to return to school and sports.
Safe return to play is a process guided by medical professionals. Returning to school and play should be gradual. Make sure to follow the child's doctor's recommendations and only allow them to return when they're fully ready. Skipping steps can lead to long-term complications. Following safety protocols reduces risk significantly.
Aloha everyone, I'm Troy Furutani with HCAMP from the University of Hawaii's College of Education, and we want to thank you for participating. Young children under 13 require special attention when it comes to concussions. Their developing brains may take longer to heal, so it's crucial to seek medical care right away. Be sure to notify your child's school and advocate for any adjustments that may be needed in the classroom. Constant sleep and balanced nutrition are especially important during recovery. They give the brain the energy it needs to recover. When it's time to think about returning to activity, follow a clear, step-by-step plan under the medical supervision to ensure your child is ready for competition.
For more information and resources, visit hawaiiconcussion.com.